Good afternoon everyone and welcome to our live broadcast around fatigue with Professor Drew Dawson. My name's Tegan Moderman and I'm the Director of Psychological Health with Workplace Health and Safety Queensland. Now this live broadcast is brought to you as part of Safe Work Month, which is celebrated nationally throughout October. In Queensland we deliver a wide range of activities including our Injury Prevention and Management Conference, our Safe Work Month Awards and our breakfast forums. So it's also Mental Health Week, which promotes the importance of mental health and wellbeing and reduces the stigma associated with mental illness, should I say. So this year the theme is Take Time, and I'd like to thank you for taking the time to listen to our live broadcast to understand more about fatigue. Now fatigue is a really unique hazard. It's something that every single one of us can experience at some point in time in our lives. It's not something that we can always plan for as well. So as such, we need to have robust strategies in place, both individually as well as organisationally, to control for the risk of fatigue-related incidents, but also to enhance the wellbeing, both the physical and psychological wellbeing of our workforce. Now we're very lucky today to have Drew Dawson as our speaker. He is nationally and internationally recognised for his fatigue-related contributions. He's currently the Director of the Appleton Institute, and will be talking to us today about the latest research on shift work and how it affects the body, and exploring strategies on how to minimise fatigue-related risk. So the format for today's live broadcast will be, firstly Drew will present, and then the two of us will have some informal discussion around some of the questions that you may ask during the session. So I encourage you as listeners to ask any questions throughout, and we'll try and live stream those to Drew, or we'll wait towards the end of the session and we'll ask some more questions. But I'll now pass over to Drew to talk to you about fatigue. Welcome, Drew.
Thank you very much, Tegan. So welcome all. This is a bit of a new experience for me. It's kind of weird talking out into nothingness, but I'm going to try and start off and keep your attention, and I'm going to make a couple of what I believe are quite controversial statements in the area of fatigue management. And the first is that you can't eliminate fatigue. I'm going to say that again. You can't eliminate fatigue. And the reason for this is really simple. If you're working at 4 o'clock in the morning, it doesn't matter how much sleep you've had, you're still going to be fatigued. Not because you've been up for particularly long, but because your body clock is at the wrong point. You're in your window of circadian low. So one of the things that we think is really important for organisations to understand is to change the narrative and the way that they talk about fatigue. Rather than saying if we comply with our rules of rostering, then fatigue won't be a problem, we actually think a far more useful way for organisations to think about this is to think about how can I work safely when I'm fatigued? And we think that's important for a couple of reasons. One, it acknowledges that fatigue is an inevitable consequence of shift work. It's an inevitable consequence that sometimes you'll be up with a sick kid, or you might be running late, or you may have had a bad night's sleep. You can't get rid of fatigue in the workplace. And what we think is that if you change the narrative around that, you'll lead to some very interesting conversations within your workplace. The second thing I'd like to talk about, and again, is I don't really care whether you're fatigued. You'll see lots of workplace policies and stuff that say to people, if you're fatigued, you need to notify your employer and you need to not work. Part of the problem with those rules is that everybody knows that they're stupid. When we're thinking about fatigue, the important thing for us to think about is the risk, not the actual fatigue. As I said, we can't eliminate fatigue, but what we can do is start to think about fatigue in an honest and realistic way, and think about some of the things that we can do to eliminate the risk associated with fatigue, rather than eliminating fatigue per se. And the last thing I'd like to say is we're going to talk about some of the reasons why organisations find it really difficult to talk about fatigue. I think there's a couple of really important reasons for this. The first is everyone gets nervous. Fatigue management is secret code for overtime reduction strategy, or it's going to cost us 10% of the next DBA in additional hours or overtime penalty payments. Most people are frightened about having a conversation about fatigue because they don't know how to manage it. I'm going to say to you, we have all the tools that we need now to manage fatigue very, very effectively. And what I'm going to do is go through some of the regulatory frameworks and the tools that are available now that will make it very easy for you and your organisations to think about how to manage fatigue. So, let's start off with this. I've been working around the world for the last 5 or 10 years, looking at how organisations and how regulatory environments are starting to think about fatigue. And there's a couple of interesting things that have happened. There's been a big push towards what we call fatigue risk management systems, but also a pushback because some organisations found the complexity and the information technology systems required to manage a pure FRMS system very difficult. And many regulators didn't have enough people in place in order to enforce those regulations. What we've seen happen around the world is an increasing shift, and particularly in the English-speaking world, an increasing shift to what we call hybrid models. And the hybrid models are very simple in the sense that they say, if the risk is really low, just get on with it. So if you're working, for example, Monday to Friday, 9 to 5, weekends off, the likelihood of work-related fatigue is really low. And other than having something in place to identify when somebody may not be fit for work due to non-work-related causes, you don't need to think about it a lot. But as the likelihood of fatigue goes up, and therefore the risk of fatigue goes up, the more the controls that we need to put in place. So if you look at the diagram here, you'll see that we have an emerging principle where we have what's effectively the green zone, and within the rule sets sitting around your hours of work and those kind of things, if it sits within that Monday to Friday, 9 to 5 kind of working practices, then you don't really need to think about it too much. On the other hand, as the risk increases, and you can see as you move outside of the green circle into the yellow circle, there's a slight increase in risk, and therefore you will require moderate levels of controls in order to do that. As you go further out and hit the orange zone, then you'll find that that needs major controls if people are to continue to work. And then finally there'll be a red zone where you really don't want people operating there unless the risks of ceasing to work outweigh the risks of continuing to work. And they could be situations in emergency services or healthcare or those situations. Sometimes a tired doctor is better than no doctor at all. The other thing that's important to understand here is that in these hybrid environments there tends to be some rules of rostering or general principles that are used to define when you're within the green zone, when you're in the yellow and orange zones, and when you're in the red zone. And the general principle is if you're in the green zone, you can probably work with your rules of rostering, and you probably shouldn't be going into the red zone. But from a risk-based perspective, if you're operating in the yellow and the orange zones, it's critical that you have a clear process for assessing the risk, that is how far from the green zone you are, and then putting in place controls that are appropriate to mitigate the risk. Now, we've done some work over the last couple of years with a lot of regulatory agencies, and as you'll see on the graph here, or the diagram here, there are 5 key dimensions around rosters that people work, and there's a pretty good body of research to support the relative risks associated with a working time arrangement based on these 5 dimensions. That's how many hours you work per week, how long the shifts you work are, how short the breaks are between shifts, whether you work night work or not, and how often you get a weekend break. And by that we mean a reset break or a weekend break, which is 2 nights sleep and a day off in between. And as you can see from the diagram here, if you're working less than 45 hours a week, if your shift durations are less than 10 hours, if you're getting at least 14 hours off between shifts, you work no night work, and by that we typically mean somewhere between 8 p.m. and 8 a.m. And if you're getting at least 1 weekend break a week, fatigue's probably not likely to be a major problem as a result of your working time arrangement. On the other hand, if it exceeds 72 hours per week, if your shifts are longer than 14 hours, if your break durations are less than 10 hours, if you're working night work, and if you're getting a reset break less than once a week, up to once every 2 weeks, then we know once you exceed those limits, it's probably difficult for any organisation to manage the risks unless it's in an emergency services environment. So these broad principles gives organisations a way of determining, am I in the green zone and I don't need to do a lot? Am I in the fatigue risk management zone where I need to be able to assess and manage the risk? Or is what I'm proposing beyond the pale? And there are some environments where that's possible, but we would suggest there would be a reversal of the burden of proof and people need to demonstrate that they can do it. But what these measures indicate is the likelihood of fatigue. These will tell you how likely it is that somebody will be fatigued. And if you've worked from a risk management perspective, you know that you'll be required to categorise that on a scale of 1 to 5, from 1, which is very unlikely, to 5, which is almost certain. But likelihood doesn't tell you the risk. And as many of you will know, the Australian Standard for Risk Management, which has now been adopted by the International Standards Organisation, or ISO 31000, sets up a very simple risk matrix which requires you to assess the likelihood of fatigue, the consequence of a fatigue-related error, and then use those two pieces of information in order to determine the level of risk. And having determined the level of risk, as you saw from that previous diagram, we then require people to identify the risk and then put in place the mitigations that are necessary in order to continue work. So you'll see again, if it's green, you probably don't need additional controls. If it's a moderate risk, you need minor additional controls. If it's a high risk, you need significant additional controls. And if it's in an extreme risk situation, it's probably only going to occur in emergency or exceptional circumstances situations.
Can I just jump in there with
Sure.
a question, Drew? We've just had one come online. With the emergency zone, what about the workers on offshore rig where they normally do 14 hours on, 14 hours off?
I don't think they do 14 hours on, 14 hours off. That's a 28-hour day. So that would move around. If they are doing that, and I guess it's possible, my understanding was that they did 14/10s on most of the offshore rigs. But if they're doing 14 hours on, then you can see it as right at the upper limit. The breaks are a little bit bigger, but the interesting thing then is if they are moving 28 hours per cycle, then they'll be moving around the clock continuously. So as the people who probably work those shifts know, they're going to be very fatigued at certain times in the cycle. Okay, so now I'm going to talk about how we determine the likelihood and how we determine the consequence of particular behaviours in the workplace. And I'm going to use a model that's well accepted in Australia and around the world. This is based on some work done by a graduate student of mine, Kirsty McCulloch, and myself about 12 years ago. This is what's referred to as the Defences in Depth model. And it's a very simple model which says that if there is a fatigue-related accident, there's probably a series of causally linked events that lead up to that incident. Somebody may not have had an adequate opportunity to sleep. Somebody may have had an adequate opportunity to sleep but didn't use it to get sufficient sleep. As a result, they didn't have enough sleep. They exhibited signs and symptoms of fatigue. That led to an error, and then as a consequence, that led to an incident. In most organisations, we focus on regulating the working time arrangement, and that's the only defence that we have in place. But if you think about it, if we had techniques to identify when people haven't had sufficient sleep, when they are exhibiting the signs and symptoms of fatigue, or when they're making errors, we have a whole range of other areas where we can start to intervene to identify when people are at risk because the likelihood of fatigue is higher. Now, if we take those principles, it's sometimes referred to as the 5 levels of control for fatigue. And on those levels of control, we've taken all of the things that are done around managing fatigue and tried to put them into a simple model. Level 1, which is the furthest from the incident, is the sleep opportunity or the working time arrangement. What do you have in place to ensure that people are provided an adequate sleep opportunity? At level 2, you want to know how much sleep and wake did somebody actually get? Because the sleep opportunity only tells you what happens on average to most people. On the other hand, what happens to you today can be very different to what happens on average. What can we do to identify how much sleep and wake you've had in the last 24 or 48 hours, and how can we use that to get a better estimate of the likelihood of fatigue? Similarly, observed fatigue behaviours, fatigue-related errors, and fatigued incidents can be part of that. What I'd like to do is to take you through now some very simple principles, but before you do that, I'm just going to show you a quick slide that shows you a free fatigue calculator that you can use that will enable you to do all of the things that I show you in the next few minutes. So, if we go to the level 1, sleep opportunity, those 5 dimensions I talked about before enable you to look at the working time arrangement over a 7-day period and then determine the total number of hours, the longest shift, the shortest break, how many hours occurred at night, and how long or how many days between the reset breaks. And you can score it up, and based on the outcome from that, you'll get a score somewhere between 0 and 40. If you take that score, you can determine the likelihood. Most rosters that people work will give you a score somewhere between 5 and 30, and as the colour coding shows, it will give you a likelihood score somewhere between 5 and 30 out of that overall maximum of 40. What we've done is then calibrated that against the ISO 31005 levels, and those ISO 31000 levels have been calibrated in the following graph. So if you get a score of 0 to 5, you can assess the likelihood as a level 1 using ISO 31000 with a degree of certainty. Similarly, as the score goes up, so does the likelihood. And then as you determine the likelihood and the consequence of a fatigue-related error, then you can determine what the risk is, and then having done that, you can look at the risk mitigations that should be put in place. And for most organisations, there will be a process whereby you take those risk assessments and then put in place the appropriate controls to manage that. And on the next slide, you will see some work that's been done by a number of organisations where the risk is and the types of controls that can be put in place. And you'll see in very simple terms, in a low risk environment, you're good to go. In a moderate risk environment, they are what we call self-managed controls, look after yourself. In a high risk environment, it's look after each other. That's what we call team-based processes. And in the red zone or the extreme, just look out, full stop. That is, if we go through these, an increasing level of risk mitigation. Now, these risk mitigation actions will actually be decided in advance by an organisation, often at the work group level. But that just shows you what to do with the sleep opportunity. The second thing that we can look at is how much sleep and how much wake you've been able to get. Again, using the app, you'll get a number of questions that you can answer, and they will enable you to put in the amount of sleep you've had in the prior 24 and 48 hours, when you woke up, when you started work and when you're finishing work, and then that will give you a series of scores based on the start and the end of the shift and then into the next 24 hours, so you can see the implications of starting early, extending your shift, and use that for planning purposes. Now, you don't need to go into the details today, but the app will give you a score, and if you look at the next slide, you'll see that those scores have been put on a range of 0 to 14, which is what you typically see in most workplaces for most people. At the bottom, a score of 0 means that you're probably able to work safely at most tasks most of the time, and by the time you get up to a score of 12 to 14, then you're pretty tired. Again, on the right-hand side, you will see that we have calibrated those against a well-recognised standard for fatigue, which is the Karolinska Sleepiness Scale. For those of you who are familiar with that, you'll see that a score of 0 equates to a Karolinska Sleepiness score of 6, 4 goes to 7, 6 goes to 8, and 12 goes to 9. So they give you an indication of the level of fatigue. By plugging in your own personal sleep and wake scores, you're able to do that. And then again, we have taken the liberty of calibrating those against the ISO 31000 scale. And there you can see with a score of 0, you would have a likelihood of 1, and by the time your score goes up to 12 plus, you have a score of 5. Then, depending on the task that you are doing, you would go to your risk matrix, and again, having gone to your risk matrix, you would be in a position to be able to determine what would be the appropriate mitigations to put in place. The third level that you can operate this at is in terms of the behaviour indicators, and what we would suggest you use is the Karolinska Sleepiness Scale. A lot of times we see organisations who invented their own scale, and there's nothing wrong with that until you have to go to court. And then you're going to be asked, why did you select that scale? And you say, well, it seemed like a good thing to make it up at the time. That's not really a good legal defence in our opinion. So what we would suggest to you is use the Karolinska Sleepiness Scale for a couple of reasons. A, it's in the public domain. B, it's very well validated. It's been used in probably over 1,000 studies. It's well calibrated. We've done lots of experiments where we look at people's KSS scores and how they perform in the workplace. It's legally and scientifically defensible, and probably more importantly, it's free. So again, you can see on the left-hand side of the slide, it's a 1 to 9 point scale that goes from extremely alert through to very sleepy, great effort to keep awake and fighting sleep. In that situation, you can again calibrate it against the ISO 31000 scores. And you'll see here, a likelihood score of 1 equates to a Karolinska sleepiness scale of 1, and then a 5 is at 8 plus. You look at it again in terms of your risk matrix. You put in place the controls that have been determined for your organisation. And then having done that, you're in a position to determine the likelihood of fatigue from either the working time arrangement, the prior sleep wake, or the behavioural symptoms of that. And for those of you who missed it, I'll put the last slide up, which shows you where you could download that app for free from. And then we'll close it now, and I'm going to join Tegan for some questions. Thank you very much.
Thank you, Drew. You can certainly see your passion and your insight and expertise into the topic of fatigue there. What drives you to be interested in this? I know I've been following you for 20 years now, and I know that it's definitely an interest of you. What drives you to be interested in the area of fatigue?
Well, it's actually quite a personal story, Tegan.
Yeah.
When I was first in research, and we're doing lots of stuff around sleep and shift work and melatonin and those kind of things, my wife was doing her internship year as a doctor, and she used to ring me up and say, can you please come and pick me up because I'm too tired to drive home. I just want to finish off a couple of patients and then I'll be ready. And I said, you may want to rephrase that because it doesn't sound great. But it struck me as, I'm not okay to drive, but I'm required to look after patients. And then when we started to look at fatigue, we realised lots of people die as a consequence of fatigue-related errors. And it was a great way to take really good science and make a difference in the world.
And it's interesting what you say there in terms of most people can maybe identify that they're not safe, but yet they still want to work on, or they still want to just do a couple of things to close out their job. Is there some reason for that, why we can maybe identify that we are fatigued enough to not be safe, but we still want to work on?
Well, again, I think as people have often said, the road to hell is paved with good intentions. People don't want to let the team down. They want to get the job done. They don't want to be seen as a leaner as distinct to a lifter. So there are all sorts of reasons why people would want to do it. The difficulty is, while people are very good at determining whether they're fatigued or not, they're very bad at identifying whether they're safe or not.
Yeah.
The tools that we're showing you enable you to use a systematic process for determining how safe you are, or what the level of risk is, and whether you should or shouldn't be doing it, or if you need to continue, which is sometimes the case, because as we know, a tired doctor is better than no doctor at all. What controls do I need in order to work safely whilst fatigued?
Yeah, and I think you raised a really good point around having valid and reliable tools, and you've certainly identified some free tools there that are available. I've noticed there's a lot of technology that's coming onto the market. How does an organisation ensure that that technology, if they are integrating that into their safety management system, that they're doing their due diligence, I guess you can say, around the technology they're using?
Well, I think you need to look at the technology and say, has it been trialled? Has it been tested? Has it been tested in the field? What are the validation and calibration data for it? But I think it's important to understand that often people will look at those technologies and say, oh, but it's not perfect. It doesn't work when the moon is in Aquarius or something like that.
Yeah.
That's not actually the right question to ask. The right question to ask is it better than what we're already doing? And sometimes perfect can be the enemy of better. So what we say to organisations, if it increases the certainty that your people are fit for work or not fit for work, then it's probably a good thing to put in place. And if it makes sense from a financial perspective, sometimes having a not so good tool for everybody is better than having a really, really cool, good tool for just one or two people.
Yeah, and I do notice that in industry there's definitely a drive to have the perfect roster, and a lot of effort and time spent into, you know, consulting with staff and designing the perfect roster. Is there such a thing as a perfect roster?
Well, no, and as you know from the rail industry from many years ago, when we did the research on this, half the time that somebody's fatigued in the workplace, it's due to non-work related causes.
Yeah.
So the biggest thing most organisations can do in this day and age is to think about what we call a shared responsibility model. The new workplace health and safety legislation puts a statutory obligation on employees to identify a workplace hazard, even if they themselves are the hazard. So the biggest area we've seen in the last couple of years of development is around that shared responsibility and giving people a just culture framework and the tools so they can put up their hand and correctly identify when there's a high level of risk and mitigate it.
Yeah.
And it's not going to be an epidemic.
We certainly see that, and what you're saying to me is that seeing hazard as self, so seeing fatigue as a hazard as self and then managing it in that way.
Well, it's a really important issue, and this notion of self as hazard, and it's not just fatigue, it can be drugs and alcohol, it can be bullying and harassment, but we have a whole emerging set of what we call 21st century hazards where the individual as an employee or a manager are themselves the hazard. One of the challenges is our systems for managing hazards are really good at boots, belts, buckles, saws and that stuff. They're not so good for psychological hazards, and fatigue is one of the best examples of that.
Yeah, no, absolutely. Do we have any questions from the audience?
We do have a few questions. So while we're talking about risks, Joel would like to know, how do you take into consideration the risks inherent in the work people are performing in assessing risk?
It's actually really easy. We sit down in a room with a bunch of people who do a particular job and say, tell us the dumb things that happen when you're fatigued. And we get people to tell the stories about what they do. Now, 9 times out of 10 that works. Occasionally, like if we're working with pilots or doctors, we have to ask them the dumb stuff other people do because they tend not to report it. But if you legitimise the narrative, if you say it's okay to talk about fatigue, tell us the dumb stuff that happens, you'll really struggle to shut people up at that point. Once you know what goes wrong when people are fatigued, you can work on fixing it.
We also had just another question here, Peter asking about the variation in the sleepiness scale between different nationalities. So is there a variation in that scale with regard to that?
Not that I'm aware of, Peter. That scale has been used right around the world in developing countries, developed countries, men, women, all sorts of different people. And it seems with the proviso that sometimes you have to translate it from English or its original, which was in Swedish, and sometimes there have been some difficulties around exact translation, but once it's translated well, it seems to be a very robust and powerful tool to use. The other important thing about this tool is rather than having to put your hand up for your supervisor or your boss and go, I'm tired, you can say, I haven't had sufficient sleep to work safely today, or my Karolinska sleepiness scale score is 8. And that takes a lot of the emotion out of reporting fatigue that we observe in many workplaces.
Actually, and on that topic, that probably leads into Matthew's question. He said the self-assessment protocol is quite subjective, especially given casual team members risk losing hours if admitting to fatigue. So are there quantitative testing to make this more qualitative?
Yeah, look, it's a good point, and again, I'll go back to the thing I said, perfect becomes the enemy of better. We don't have a roadside test or an objective blood alcohol equivalent where we can measure you and say your fatigue level is X. Maybe in 10 or 20 or 30 years that technology may emerge, but actually it's more a cultural question. People are really good at telling you how fatigued they are. In fact, the best way to find out how fatigued somebody is to ask them. The challenge is, however, getting them to do that in a way where they understand the risk. And you're right, sometimes people go, I want that extra $20 or I need that overtime. Part of the cultural re-engineering process is to get people to focus on lifetime earnings versus weekly earnings. So they can be key issues. So you don't earn a lot of money when you're dead.
Adam had another interesting question. With automation becoming a very real thing, do you think the future could see jobs that cause high levels of fatigue being replaced by machines, and would this be a good thing?
I was asked to give a big talk on this in Texas a couple of months ago, and what will be the implications of it. It's a really complex and sophisticated question, because as we go to increasing levels of automation, the car isn't absolutely automated. You still have to be managing the car and responsible for it. But we're going to put people into a car that manages itself most of the time except in an emergency, and then we're going to say, don't do anything. You just got to try and stay awake and monitor it. And I suspect that's going to be really challenging for people, because the temptation to use their iPad or their phone or read a book and all of those kind of things is going to be very powerful. And you can be required to reassume control of a car within 2 to 4 seconds. And if you're busy reading, or if you're sitting at night in an automated car, the chances of falling asleep are much higher because you're not doing anything, you're not even driving. So I think there's going to be some really big challenges, but I think where you can fully automate people out of the system, and I think modern aviation is a really good example of that, and the space shuttle to a certain extent, those situations where you can engineer people out of it, the difficulty is people aren't going to get into a plane that doesn't have a pilot, I suspect, for a long time. So how we manage those situations is going to be a real challenge from a cultural and an engineering perspective.
And there was another question as well from Rowan, who said there's a big gap between what shifts are rostered and the actual hours that staff work. So how do we move to a more real-time and automated notification systems, especially when there's, in many industries, a lack of that regulatory requirements and the transparency?
Yeah,
actual errors. Yeah,
it's a really good question. Most people who are managing fatigue will have a requirement to report both proposed or scheduled and actual working time arrangements. The tool that I demonstrated today is quite good because it can be used by a worker and a supervisor to measure what hours they actually worked, not what they were scheduled to work, and it will give you an indication of the likelihood of fatigue as a result of that. At a more sophisticated levels, there are biomathematical software packages which enable you to put in your proposed or scheduled hours and then your actual hours and see the discrepancy between them. I think the key point I'd make is it's a really important issue. What you actually work is what we're interested in, but in a lot of environments we can't necessarily have that highly accurately in real time. We can look at it retrospectively and say how often did we get it right, but the kind of tools that we're showing you today do enable you to have a go at assessing the risk from what's actually going on, not what was planned.
Joel has also said, thanks Drew, we're working with doctors here, but what are your tips on implementation of a FRMS?
The fatigue-related systems.
My suggestion to you is a few years ago we developed the fatigue risk management guidelines for Queensland Health. They are readily available on the web and they are still pretty good, and they've just been picked up by the Canadian government for healthcare in Canada. So I would recommend you look at those, and I'm sure if you want to drop me an email if you can't find them, but if you go and look for Fatigue Risk Management Resource Pack on the web, you will find a downloadable site where you can get all that information.
In implementing those systems, sometimes there is barriers. Do you have any tips from a change management perspective? How do you get buy-in from those who are working with such high workloads and variable hours, shift work and the like?
Yeah, that's a really good question too. Part of the challenge in organisations is the threat of fatigue management for the supervisor or for the operational people is I'm not going to be able to get the job done. And I need to get the job done, and my performance appraisal requires that. And with a bit of luck, if nothing goes wrong, we won't have a fatigue-related accident. So in those situations, people understandably gamble a low likelihood, high consequence event against a relatively low consequence but high frequency event all the time. Our experience has been most organisations find the idea of somebody dying in a car accident or a fatality like that very hard to wrap their heads around. One of the techniques we've been using, and again this goes back to what we did with Queensland Health, what we call politely complacency disruption events. What we will do is get people to envisage the actual scenario that they're going to have to deal with. So we will have senior managers have to explain to an actress playing the wife of a deceased employee, or we will put people into a coroner's court simulation and have them cross-examined by a QC. Those kind of real world experiences tend to focus people's attention on how difficult managing the consequences of a bad outcome from a fatigue-related accident, get people to actually focus on it, and generally they then start to take it quite seriously. But at the moment it doesn't impact on them directly, or they don't think it will be. The new workplace health and safety laws are going to change that fundamentally.
And we did have another question here from Peter, just in relation to applying the tools to the team environment. So specifically, they've used an example about if you've got a team of 2 driving, is it about sharing and driving those tasks? Is it as simple as that, or is it there more complexities around sharing some of these tools around that team?
Well, again, you've just showed how to use the tools in a very simple way of deciding who to drive at a particular time. And if somebody is a bit under the weather, let them have a drive and maybe have a bit of a rest, or work out which bits of the drive you should or shouldn't do. We've given up trying to predict all the clever way people will use the tools. The tools enable you to assess likelihood and therefore to calculate risk and work out what controls you need. Our experience has been when you let people use these tools, they're really good at using them because it empowers them and gives them agency in how to manage and quantify fatigue and to talk about it at the organisational level. If you say the fatigue risk today is high, then people go, oh, we better do something about that. Whereas if you go, I'm tired, that doesn't seem to carry the same weight in an operational environment.
In terms of, before you just mentioned the WHS laws, just I guess a question for those who are in senior management roles or management roles, what are some of the things that they can do to exercise their due diligence or to be able to demonstrate that?
Well, I think you have to demonstrate that you've undertaken a risk assessment, you've identified whether a fatigue is a potential hazard for your employees, and to the extent that it is a hazard, you need to have a system for ensuring a safe system of work and managing it. So it's not doing anything different to you would do for any other hazard. The challenge, I think, for senior managers is that they have traditionally seen fatigue as an industrial issue that's managed through the enterprise bargaining agreement, and that's where it's done. But actually it's a safety issue. So if there's any senior managers out there, the single most important thing you can do is to ensure that it goes on the safety agenda and comes out of the industrial relations agenda. Doesn't mean that there aren't industrial implications of a working time arrangement, and we will talk about the fact that rosters have to be family friendly, financially friendly and fatigue friendly, but fatigue friendly risk assessment and mitigation belongs in the safety department, not in the IR/HR space.
Do we have any other questions online?
We do. Just going back to the tool, the question from Erin is: can journey lengths be adjusted with the tool, particularly for industries such as mining or energy, where travel to work is rarely publicly offered and there are often many hours of travel involved?
Yeah, just add the travel hours to the working hours. So if you've got a 12-hour shift with an hour and a half commute at either end, then it becomes a 15-hour shift. So it shows people are thinking about how to use the tool. That's fantastic. Well done, Erin.
Yeah.
I think that's just about it, really, for our questions online.
Yeah. Did you have anything else, Drew, that you wanted to talk about? Any key things that you're seeing or trends you're seeing in industry that you wanted to alert people to, or emerging issues?
I think probably the biggest issue over the next 5 years is going to be how organisations respond to the changes in the workplace health and safety legislation, particularly around shared responsibility. And there's been a lot of conversation that we've been having with the road transport industry. They have changed enormously in the last few years. And what we've seen interestingly emerge from a lot of organisations is what they call an absolute authority to stop. If a driver puts their hand up and says, I'm not good to go, then it's uncontestable. So there is no discussion, argument. You pull over, you do what you need to do. If it happens too often, then there will be what we politely refer to as a root cause analysis, and we will look at understanding why that is. But at the moment, or on the day, it's an uncontestable right, because if you told somebody to keep working and there was an accident, think about the legal implications of that for you as a manager or for you as an organisation. So I think that shared responsibility, empowering employees to be part of that decision-making process, is going to be the next frontier in fatigue management. It's going to be a lot less about rosters.
I think working in the regulator, we often see that as well in terms of trends. I think seeing the hazard as self, or self as hazard as you called it, with the individual, we often see systems that don't tend to do the risk assessment of the particular individual and put in controls so that they can't drive home, or there's alternative accommodation or alternative transport and those sorts of things. We also see that when they are doing their investigations, that they're perhaps not drilling down past their hours of work and looking at maybe the other factors like sleep that may have contributed to a fatigue related accident, or an accident that may have had fatigue present at the time.
Yep.
Is that something that you've been seeing as well in your conversations with industry?
Well, I think we're starting to move to more systematic approaches for identifying the link between fatigue, error, accident and injury. But I think the other thing that's probably worth thinking about is we do a lot of work with organisations where people do work overtime and they've worked big hours for many years safely. And the key point about this is to say to organisations, and organisations may indeed say this back to their employees, if you want to work the big hours, that's fine, that's your choice. But you've got to demonstrate to us that you can do it safely. And the onus is increasingly on the organisation and the employee to demonstrate where you are working the big hours. That's fine, but you've got to demonstrate that you can do it safely. And our experience has been there's lots of people working big hours who do it very safely most of the time. So it's not getting rid of long working hours per se, but going back to what we said at the start of the day, ensuring that you can work safely if and when you are fatigued.
We have had just another question come in. This one's from John. He's interested in knowing what you think might be, I guess, the worst mistakes that Australia is making in fatigue, which we'll perhaps look back on in the future, and potentially be really, embarrassed by that we were getting it so wrong.
I think if you look back, and it's an interesting question, I think the obsession with the roster as the only control that we have in place. And I see lots of fatigue management plans for organisation, which is basically 3 or 4 paragraphs carved out of their EBA. I think once you realise it's not just about the roster, then we'll probably see things move forward. And once you stop arguing about the roster, it actually becomes really easy to manage fatigue well. The roster just gets in the way all the time.
You've mentioned the app you've spoken about. You mentioned the resource that it was developed a few years ago for Queensland Health. Are there other resources that you could point our audience to that they might find useful?
Yeah, I think if you Google fatigue risk management, you will find an incredible amount of resources. Some of them are more suited to large, well-resourced, big organisations, but for example, the tool we showed you today, that was developed specifically in response to small organisations who couldn't afford the great big software packages and those tools, and they wanted something to structure a conversation between an employee and a supervisor on the spot. So I think we're starting to see a lot of those tools are out there. We've seen the Fitbits and equivalents emerge in the last few years, which enable people to know exactly how much sleep they have or haven't had and to use that to demonstrate that. And there are increasingly products and wearable computing on the market that will use that information to estimate likely levels of fatigue and that kind of stuff. So I think there's a lot of stuff happening in that space. And generally we have said to people, if you want to work the big hours, prove to us you can do it safely, and here are the kind of tools and technologies, whether it be fatigue detection devices in cabs of trucks, or people wearing the Fitbits or Ready Bands or those kind of things, or using other techniques. Where you say to people, you need to demonstrate to us that you can do it safely, people are pretty good at doing that.
Yeah.
And there's probably just another couple of questions, but Ashley's just asked, is there a way to assess the fatigue score of split shifts? The app doesn't seem to recognise the shift ending on a following day either, so is there a way of doing that?
That's a really good question, and no, it doesn't. But we have that. There is a workaround for that, which would be to summarise the shift to say if it was 7 hours, 4-hour break, 7 hours, call it a 14-hour shift. You won't go too far wrong with doing that. But it's a good point, it doesn't do split shifts, but there are relatively few people working split shifts, but I'm going to think about how we might incorporate that into it.
And another one about the fatigue calculator app, just suggesting that it's not available in this country or region. That's what the store is saying.
Because they didn't use the web address on the bottom, they just Googled fatigue calculator and it's gone to something else. If you use the www.fatiguecalculatораpp.com, it will go to the site. And if you have any problems, send me an email and we'll put you onto the developers.
Excellent. Well, I think we might wrap it up there. Thank you very much, Drew. Very insightful as always. And I guess some key takeaways from me is make sure that we look at fatigue as a hazard and incorporate it into our safety risk management systems, and make sure as individuals that we use as many apps as possible and communicate in a layman's way, I guess, to our managers, that we're not fit for duty when we're not fit for duty, and be comfortable with that.
Yep.
Yeah.
And it's okay.
Yeah, it's okay.
Yep.
Excellent. Well, thank you all very much for joining us and taking the time to learn a little bit about fatigue management today. We do have our mental health forum tomorrow, so hopefully we'll see some of you there tomorrow. If you did want some more resources around mental health and fatigue management in particular, I encourage you to go to our website. We are in the process of developing a new handbook for preventing and managing fatigue-related risk, and we hope to have that out to you very soon. But in the meantime, enjoy and take care and be safe. Thank you.
Thank you.